My name is Winston Evans, and this is my bioethics presentation on whether or not physicians should assist in patient suicide. Get into whether or not physicians should assist with patient suicide. We need to understand what exactly is physician-assisted suicide. Assisted suicide is suicide with help from another person, such as a doctor, to end suffering from severe physical illness. The term is often used interchangeably with physician-assisted suicide, which involves the doctor knowingly and intentionally providing a person with the knowledge or means, or even both, required to commit suicide. This includes counseling about lethal doses of drugs, prescribing such lethal doses, or supplying the drugs. Should physicians assist patients with attempted suicide? No, they should not. Assist us to live, not die. Physicians are healers. Not help with patient-assisted suicide. But why? It provides a financial incentive for premature deaths. Since it's always cheaper to give a patient a suicide pill than to provide real care, imagine the financial incentives prescribed suicide offers to HMOs, government payers, insurance companies, and air. It invites pressure and coercion. While measures require paper forms and stipulate that suicide requests be made voluntarily, subtle pressure and even outright coercion at the bedside of vulnerable patients are extremely difficult, if not impossible, to detect and prosecute. Pressure-producing statements whispered at bedside may cause a patient to feel guilty about burdening loved ones. They may take suicide cues from a physician's comment about healthcare costs. The right to die quickly morphs into the duty to die. Vulnerability of socially marginalized groups. No matter how carefully any guidelines for doctor-prescribed suicide are framed, the practice will be implemented through the prism of social inequality and bias that characterizes the delivery of services in all segments of our society, including healthcare. The practices will pose the greatest risk to those socially marginalized groups. Ethics of assisted suicide. Doctor-prescribed suicide is not needed. Under existing law, every patient and or his designated decision maker has the right to refuse prolonging life by artificial means, known as a DNR. A DNR is known as a no-code or allow natural death. No one has to linger indefinitely when natural causes would lead to death. It is ethically acceptable to refuse or discontinue futile treatments. Because it would destroy the doctor-patient relationship, the most fundamental part of a doctor-patient relationship is trust. If doctor-prescribed suicide were legal, patients wouldn't know if the doctor's ultimate motive was to heal them or end their life. The doctor's duty is to kill the pain, not the patient. Virtues and physician-assisted suicide. To be virtuous means to do the right thing while possessing a set of virtues to live your life by. Courage, tolerance, patience, reasonableness, tactfulness are all just a few of the essential virtues we as individuals should possess. These virtues cannot be linked to physician-assisted suicide. No matter what we go through, suicide should not be an option because there is always a better way to get through whatever plagues us. The present law, the 1961 Suicide Act, decriminalized suicide to remove the needless and heartless punishment of attempted suicides and families of completed suicides. It does not prevent suicides, as no law could, but punishes those who aid or abet suicide. Nor do those opting for assisted suicide in Oregon kill themselves because of pain. In fact, pain has never even been in the top 5 reasons why people opt for an assisted suicide in Oregon. Loss of autonomy inability to do all the things that make life enjoyable, loss of dignity, and fear of being a burden all come before pain. By showing courage and having patience, tolerance, and many of the other virtues, anyone can get through what they are dealing with without the need of physicians assisting them in suicide via dangerous drugs or methods that could potentially make things worse. My closing remarks. People that seek out help through physician-assisted suicide typically suffer from depression and other mental illnesses or even loneliness. We should offer to help them through more appropriate medical means rather than using such unethical methods. For the people who are in physical pain, there are other methods to help alleviate the suffering through palliative medicine to help manage their symptoms effectively. And for the people who are close to death, they can spend their last days amongst others or in hospital care so that they are comfortable in the end. Anything less than what is mentioned above is short of what is required for human dignity. Doctors must help their patients to pass in a dignified manner from natural causes. Physicians are always responsible to care for others, not to kill. This is why we should not deem an individual's life not worthwhile and hasten their end. All life is precious, so assisted suicide should not be an option. This decision will affect not only yourself, but also your family, friends, and the physician performing the procedure. It lessens the value of life. While we as a people deserve the right to choose, it is something that should not be exercised. Thank you for watching my presentation, and I hope you've gained knowledge on the topic of physician-assisted suicide.